Good evening, everyone. I haven't introduced myself yet, even though I told you I live in Central New York. My name is Paula Carey, and it's so nice to be with you this evening. It's my pleasure to talk to you tonight about the OT process and occupational profile, and really to talk about how integral this content is to the certification exam. So we already asked who's OTR, studying for the OTR exam versus the COTA, and we have a little bit of a mix. So we need to keep getting more OTAs in there, all right? And I want to tell you a little bit about myself, and then we're going to move on. Just to, you know what public speaking is, you're supposed to establish your credentials. So I started my career in occupational therapy, hard to believe, more than 40 years ago. So it's over 43 years ago. And I started in an OTA program, so a community college, and I just fell in love with it. So I was an adult. It was my first time in college. I was a single parent, and I decided I felt like this thirsty sponge that just wanted more and more information. And so I was really very fortunate that occupational therapy is a good fit for me because I didn't realize how good a fit it was going to be. I thought I would like it, but it's been amazing. So I have to tell you, if your career in occupational therapy is half as rewarding as mine has been, you're just going to love it. It's so worth it. So hang in there. I know that there are tough times in terms of getting through certain courses or getting ready for this exam. It is possible. It is doable. Don't give up. Okay. I've seen people who have really worked against huge odds and still make it through their academic program and make it through the certification exam. So remember, you can too. And I'm an eternal optimist. So that's what you're going to hear from me. So try not to quit. Hang in there, everybody. Okay. Um, if it's the career for you, if you really want it, remember why you want it, and that can help give you the motivation to move forward. So after I was in my OTA program, I realized I wanted more, that I wanted to learn more and more. And you also get good financial aid if you continue on versus stopping out for a while and then going back to school. So I had to think about the financial aid aspect too. So then I transferred into I got my COTA, took that exam, passed that, and then transferred into a bachelor's program for an entry-level degree in OT. Back then it was bachelor's entry, and passed that and took my certification exam and passed that. And those of you who are COTAs going for OTR, you know, there are some things that we should do just once and be done with it. And passing an exam of this nature is one of those things. But I'm here to help you. Any questions that you have, just let me know. I'm glad to answer them. First of all, we're going to go through the content for the evening. So hold any extraneous questions until after that. And unless it specifically relates to what I have right there, I'm not going to stop even if your questions are about the OT process or occupational profile. So after I got my entry-level degree in occupational therapy, my primary practice area was working with adults with neurocognitive disorders, developmental disabilities and neurocognitive disorders, and then working with adults and older adults in skilled nursing facilities and social day programs. So that was my primary practice area in terms of clinical practice, but my overall practice area was education. So I taught at Utica University for over 32 years, plus some adjunct work that I did. And I just loved it. I've been a program director, coordinator of a weekend program that was started out for a bridge program for OTAs to get their OT degree, and then retired in 2019. Just missed COVID by this much, so I didn't have to do all that hurry and scurry that some of you did, right? And I have a master's in adult education. I took many, many courses in a PhD program for cultural foundations of education, disability studies. And then I decided I liked disability studies, but I loved OT. So I withdrew from that program at Syracuse University and I enrolled in, sorry, I'm trying to let somebody in, it's not working. I enrolled in a post-professional doctorate program for occupational therapy. So OT has worked really well for me. Let's move on. So as you know, this is foundational information, but it's not foundational information in the same way that anatomy and physiology is. So anatomy and physiology is foundational information in terms of you understanding the human body, and then questions on this exam will relate more to function and occupational therapy evaluation and intervention. But this is foundational to the profession. So it's very important information that often underlies questions. I certainly can't tell you what percentage of the exam, because it can fit across evaluation, intervention planning, implementing intervention, and discharge. Excuse me. And some questions might be written to even fit into domain 4, which is professional management and competency for OT and professional standards and responsibilities for the OTA. So it depends on how we're viewing it and how they craft the question. So please feel free to add anything with the chat, opening up your mic, but don't try to record anything or save it in any other way, because it is copyrighted information. As you're studying for this exam, or if you're still a student, please be very careful of copyright infringement, because you don't want to be sanctioned for something that, I mean, that really is unethical. So you don't want to have that come back and hurt you. Excuse me. So I did mute everybody as you came into the room. Please keep it muted unless you're going to say something. And that's just so that we don't pick up your background noise. We've all been in on a Zoom meeting at different times where maybe there's a dog barking. I have one of those here, or a television on, or a child crying. And we just want to be able to keep moving forward with what we're doing tonight, because I know your time is valuable. So I will be checking the chat. I can't check it all the time and also keep talking. So I'll check it periodically. If I miss your question towards the end, please let me know. Please just open up the mic, post the question again, something, so that we don't miss it. So I'm going to talk about the must-know content. I'm not talking about everything in this chapter, but this is coming from chapter 3 for the OTA review and study guide, and chapter 3 for the OT review and study guide. Excuse me. Right now we're in the 4th edition of the OTA review and study guide, and one of the most common editions that's out there right now for OT is the 9th edition, and the 10th edition is now also available. Some of you may have that. So I'm relying primarily on the OTA 4th edition and the OT 9th edition, because the majority of the books that are out there right now are those editions. Do any of you have the 10th edition for the OT review and study guide? Okay. So I hit it right on that that the 9th edition is a good one to use. Sorry, we're hopping. So here's the overview of the OT process. So starts with referral, goes to screening, goes to evaluation. 2 components of the evaluation are the occupational profile, analysis of occupational performance. These sound familiar, everybody? Maybe you forget that that's what it's called when I say the OT process. So that's why I want to go through it. And then after evaluation comes intervention planning, intervention implementation, intervention review, reevaluation, discharge, and assessing outcomes. So I'm also going to show you a chart from the 10th edition of the review and study guide. Let me see if I can make that full screen. Oh, it didn't make it any larger. I tried. So here it talks, so the OT process starts back here with referral and screening. So the referral can take many different forms depending on the facility, the state, the organization. It really changes. But in some way, a referral is made for occupational therapy services. Hopefully you've seen those. So some of them are very, very specific. Others are broad. Like I've had some, it's like occupational therapy for evaluation and treatment. Boom. And some of them are, some referrals are blanket referrals. So for instance, in one skilled nursing facility where I worked, everybody who was admitted got a screening to determine if they needed a full occupational therapy evaluation or not. But everybody was screened and everybody had some basic information in their chart from an OT perspective in terms of their occupational performance or overall function. So we contributed to the overall documentation of the client's or the resident's function. So any questions on the referral part? In general, what you see in the information is that if the COTA receives the referral, they turn it over to the OT for processing. But sometimes a referral is actually documented by the ward clerk or someone. So there's a lot of variance in this. So one of the things I wanted to show you on this new document, this new table. So again, this is the 12th edition of the OT Review and Study Guide. And I'm not saying you should go out and buy it, everybody. If you have the 9th edition for OT, if you have the 4th edition for OTA, that's still fine. It has all the current information that you need. Other than what's now been added to the OT exam includes preventing professional burnout. So that is something that's not in there. But I'm willing to send you a data brief that includes that brief information if you'd like to send me an email after the course. So let me give you my email. So I still use my email. Oh, wait a minute. I got somebody in the waiting room. There we go. Sorry. Because I like the way this is organized. So although we're going to focus on the occupational therapy process for a person, realize that there's a process for groups and for populations too. So let's say you get a question that relates to you're starting a group and what's the first thing you should do? Well, the first thing for developing a group is called needs assessment. And look at this here, where you have what you should do. So you're basically doing an occupational profile or community profile. Sometimes it's referred to. Sorry, I didn't realize that was going to highlight everything. But you want to find out what's the overall need, because how can you plan a group without knowing that? So just remember that. First thing you need to do is find out about the individuals, whether you're just developing the group or it's your first meeting of the group. That'll help guide you through a lot of questions, but always pay attention to what the question's asking too, because it might have just a little different perspective on it. So I'm going to go back to my PowerPoint here. So it's very important when you're, sorry, more people coming in. It's very important when you are going through a question to pay attention to where are you in the OT process, because it can totally change the question, or the best answer. If you are in evaluation, what you do is very different than what you're doing if you're in intervention. So make sure that you note that. You want to note anything you can about the person. Remember, right now I'm primarily talking about the occupational therapy process for a person. That you want to find out what's going on with them, but you also need to have an overview of where you are in the whole process. So you find out about the individual. If it's about a client, what condition do they have? What setting are you in? What's the primary problem that you're going to address? And that just helps you to interpret the information. So it's not sufficient to just read the information. Often these questions, and you can jump in if you've experienced this, often these questions require that you interpret what's going on, that there might be a gap in the information that's actually presented. So you have to determine, so what does this really mean? What's really going on? So the screening, remember the purpose for the screening is to determine if there's a need for an evaluation, for a full evaluation. And so it just gives you a basic understanding of what's going on with the person. But it's brief, it's very focused, and it's time limited. So you aren't setting any goals, you're finding out about the client. So you might ask them about their goals and why they're there, things like that, but you don't gather a lot of information. And then when you get to the evaluation, the first thing you do is an occupational profile. So sometimes the occupational profile kind of blends in with the screening. If that person has been determined to be appropriate for evaluation, does that make sense? Because it's the initial data gathering, but you go a little bit further with the occupational profile. So I also have queued up, I think. Oh, let's see if it'll show. Hold on. You can find the template for the occupational profile on AOTA.org. So I'm sure you've seen this before. I'm just going to bring up the Word doc so you can see it. This looks familiar to everyone, doesn't it? So it's helpful to know what information is gathered in an occupational profile because you may encounter a question that says whether it's the OTR or it's the COTA who's compiling an occupational profile, what should they do? Well, often we do this by interview to find out about this, this, and this. So we want to know why they're seeking services. See how it sounds like the screening a lot? What are they currently successful in terms of their occupations, and what barriers do they perceive are impacting them being successful? We want to learn about their occupational history, personal interests and values. We want to find out some about their environment, specific personal information. Again, it's just general background information. We can also find some of that in the, oh, you can't see the occupational profile? Thank you. I wonder why that didn't show up. Hold on. I'll bet I have to do new share. All right, I'll find it. Hold on. Let me just stop share so I can bring that up. It'll be my downloads. One of the joys of using Zoom. Sorry, I just have to get out of full screen to do it. Excuse me. Thank you for letting me know. I would have kept on talking thinking that you could see it. Now, can you see it? Excuse me. Yay. Thank you. See, you always need a co-pilot with these. So you want to find out some personal information. Here's a list of some of that. And again, we're looking all the way through here, what supports their engagement in occupations, what's creating barriers or inhibiting their engagement. What are their performance patterns? So habits, routines, roles, rituals. What are their values, beliefs, and spirituality? Body functions, body structures, clients' priorities and desired target outcomes, and that wraps it up for what goes in the occupational profile. So it really has quite a bit in it now. Now, in reality, sometimes you do all of this and sometimes you do part of it. But if you do all of it, and it's not intended to be lengthy, look at the wonderful information you gather about the person. And then the occupational profile helps you to understand for the rest of your evaluation, what assessments are going to work because you've already narrowed it down some to find out more about that individual. Okay, are we back to the PowerPoint, everybody? Yes? Wonderful. So this is the link that I went to, but you just put in AOTA.org and type in occupational profile. It'll come up. So this is a brief list of what we're doing for the occupational profile, but I already went over that with you. And you can, of course, always download the OTPF as well. 4th edition. So now we move on to the rest of the evaluation. So remember, the occupational profile is part of the evaluation. And now we want to do a more complete analysis of the individual's occupational performance. So we bring in that information from the occupational profile and select our assessments. So this is something that would be important for you to know for the exam as well. What are some of the most commonly used assessments for different settings? What do they measure? And who are they intended for? So who's the intended population? And I understand that it's hard to know all of them. I didn't look in the current edition of the OT Review and Study Guide, but when I looked at it before, there was more than 100 assessments in there. And I get it, it's hard to know everything about all of those, but you would like to, what's important is to try to have an overview of all of them, but then specifically know what I'm going to refer to as the most commonly used assessments. The problem is there's no specific list for that. NBCOT does not designate these are the only assessments that will be on the exam. And we as a profession don't say these are the only assessments that we're going to use. So you have to consider, what assessments do you see frequently in the literature? What did you use on fieldwork? What did you have in school? And consider that those are going to be the most commonly used ones. But try to think also about knowing a few assessments across different settings and for different populations. So what are you going to do for infants? What are you going to do in terms of assessments and strategies for toddlers and preschoolers on up through the lifespan? So, and different settings. So what would be appropriate for a skilled nursing facility is going to be different than what you would use in an inpatient psychiatric unit. So try to make sense out of it and know a few of those. Does that make sense, everybody? That you can't know it all, but you want to know as much as possible and at least know the common ones. So I want to repeat it again for you. Know the name of the assessment, know what it measures. So why would you use it? What does it measure? And with whom would you use it? So what's the population? Sometimes the population is an age, sometimes it's a setting, sometimes it's both. So it might be, for instance, elementary school age children, and they probably would give an age range in a school setting. So that's just a good overview. And then if there's anything that's significant about the scoring, note that. So let's say that you have one assessment that scores somebody from low to high, and low is a 1 and high is a 6. But then you have another assessment that scores the opposite way, and 6 is the lowest because it's the most severe. So you just need to be able to sort that out and know which is which. So sometimes the scoring is important. So what do we do with the occupational performance, analysis of occupational performance? That's the piece that's really the role of the OTR. So the COTA can certainly contribute in many ways to gathering the information, but to synthesize it all together and to interpret it, that's the primary role of the occupational therapist. So in here, make sure that you know the difference between what can a COTA do, what can an OTR do, and who has primary responsibility. Obviously, because COTAs work under the supervision of an OTR, the OT has primary responsibility throughout the OT process. But don't devalue what the OTA can do, because they can do a lot. And some of you might be surprised to hear that COTAs actually learn assessments. So not just interview and observation, but they learn specific assessments in their academic program too. An assessment is, let me think, I have it down here. I think it's 27%. Yes, 27% of their exam. Okay, so be careful of that with questions that relate to gathering information through administering assessments and the role of the COTA. Any COTA want to jump in on that comment in terms of what you got in your academic program for assessment and the role of the COTA contributing to evaluation? Okay, so all of you out here this evening who are studying for the OTR exam, I hope you prove my hypothesis wrong. What I've seen most in the past is that COTAs know more about the role of the OTR than OTRs know about the role of the COTA, particularly as new grads. So I'm challenging you to make sure that you know the role of the COTA as well as your own role. Those of you who are COTAs who are working to become an OTR, be careful, because when you answer these questions, you have to answer from an OT perspective, not a COTA perspective. And it's just enough different that it can make you miss the question. So just be careful with that. So I want to give you two definitions here that I don't have written out. So these are just like my visual cues, but assessments are tools or strategies that you use to gather information. Does that make sense? So for instance, observation, interview are types of assessment strategies, whereas a specific assessment would be the Allen Cognitive Level Screen, the leather lacing. So it's a specific tool or strategy that you use to gather information about an individual. And evaluation is a process. It's a specific logic-driven process in which you select the assessments that you're going to use, administer those assessments, and then interpret the results. So the COTA can certainly collaborate with the OTR, and once competency has been determined, administer assessments. And who determines competency? The OTR that they're working with. So the best way for COTAs and OTRs to work is to work together as a partnership. So what are we trying to do in this evaluation? After we interpret and analyze that data that we gathered through different assessments, and we also might have record review, we develop those hypotheses about what is the person's overall occupational performance, what are their strengths, what are their limitations, and then what are their goals. So establishing goals and what are the expected outcomes given this person's condition and the setting that we're in and the length of time that we're going to see them. What can we expect as outcomes? So already from when we first start seeing the person, we're already thinking about discharge and what outcomes we might expect. And because we're already thinking about outcomes, we also have to determine what measures we're going to use to determine what those outcomes are. And then, sorry, let me just let them in. We want to identify potential intervention. So I have here a note. Please make sure that you know the text answer about what's the first intervention to provide, the best, the next, because questions tend to be crafted that way. If you already study thinking that way instead of just memorizing, you're already a step ahead trying to figure out a question. So it's good to do practice questions, but you also need to master the content. So please don't just do practice questions. So it's domain 1, evaluation is domain 1 for the OT exam, 23% of the exam as of 2024, and it's domain 1 for the OTA exam, 27% as of 2024. So what else we need to think about this? So we already talked about occupational profile analysis of occupational performance, but we also have to consider in here the role delineation between the OT and the OTA. And we aren't going to go into that in depth tonight, but realize that that's a factor to consider. And we want to keep it a client-centered process, and it's a collaborative process between the OT, the OTA, and the client. Make sure that you follow standard precautions. So that's more information that's in that chapter 3. And you want to be ethical. For example, you want to make sure to use an interpreter. The person has the right to autonomy and self-determination, and you can't ensure that that occurs unless you can really understand what they're saying and they can understand you. And a professional interpreter is better than a family member because they might be screening out some of the things that you say. So I have a question here. Can you give an example of first, best, and next intervention? Well, I can give you an example of how the question might be crafted. So let's say I'm going to make something up. The person just had a carpal tunnel release. What's the first thing the occupational therapist should do for intervention to provide range of motion? And then you have to think your way through what's first. Well, first is going to be active range of motion. And I'm not going to go into detail on that, but So you think about, what do you do first? What's the best thing to do? So this exam is testing your critical reasoning. So it's going to give you 3 or 4 answers for the regular multiple choice, 6 answers for the multi-select, and you have to say, what's the best thing to do here? And then what's next? So like it would describe something the person has made such and such progress. What should the occupational therapist do next? Or the question might be, now that the screening's been completed, what's the best thing for the COTA to do next? Or maybe it's going to say the COTA and the OTR. And so then you have to think about, what's the OT process? What comes after screening? Does that help? Or if there's an incident and somebody falls, you have to be able to determine what's the best thing to do. What's the next thing to do? What's the procedure? And how do you find the best answer in there? It's much easier to have specific questions than to, try to come up with them off the top of my head. So does that make sense, that these other things in terms of role delineation, being collaborative process, using standard precautions, and I really should change this. I should have it follow appropriate risk management strategies, because sometimes it's contact precautions, not standard precautions. But always follow standard precautions throughout the evaluation, and more in-depth precautions as needed. So what do we have for types of intervention? Excuse me. So we have prevention, meeting health needs, the change process, management, and maintenance. So these are just general categories of intervention. And what we provide, we aren't usually identifying where it fits in terms of answers for these questions, but that might be part of how the question is crafted, saying that you're running, let's say, a fall risk and fall prevention program. So that would be intervention focused on prevention. Or it might be a health literacy approach to somebody who has HIV. Okay. So intervention planning is only on the OT exam. So the OTR exam is 23% of the OT exam, and not on the OTA exam, because it's not a primary responsibility of the OTA. They can certainly contribute to it, but they're not expected to understand that, to actually actively engage in the intervention planning. So that's after the interpretation of the results of occupational performance, or the interpretation of occupational performance as a result of the evaluation process. And it's generally done according to a specific frame of reference. So it might be a biomechanical approach. It might be a motor learning approach. It might be a model of human occupation approach. So if a model of practice is mentioned, make sure your answer fits with that. So the formats of intervention planning really vary. So it's going to be, definitely you have to write goals, right? That's part of our, excuse me, documentation process and reimbursement process. So we want to make sure that we are stating exactly what the goals are with an expected outcome, and what your intervention methods are going to be. Keep it occupation based. You want to make sure that you're stating it in, so if you're looking for which would be a reasonable goal, or what would be the service, the intervention that would be provided, make sure that you're looking for skilled services. Skilled services make a difference. And you want to make it fit with the frame of reference if one's mentioned. And also the type of intervention and the degree to which we can carry that out very much depends on the setting and how frequently the person is seen, how long the expected length of stay is for that setting too, as well as what we know about the person. I don't want to leave that out. So then implementing intervention, that's the forte of the COTA. So it's 38% on the OT exam and 55%. Did I just say OTA first? 38% on the OTR exam and 55% on the COTA exam. Okay, so think about it. Where are you going to earn the most points for this exam? I see this as a game of strategy. The name of the game is either I am an OTR or I am a COTA. So think about you're trying to earn enough credit to get 450 points. The scores range from 300 to 600 and 450s passing. So domain 3 for the OT exam, domain 2 for the OTA exam has the highest percentage. Make sure you study that really well and that you know what's the best intervention according to the books. So we have a question here. Is 450 close to around 75%? No, it's not. It sounds it, and you see it out there, and people post it all the time because 450 is 75% of 600, but that's not valid because what they do is they take your raw score, whatever that is, and then they convert it to their scaled score. So that 300 to 600 is a scaled score. It has nothing to do with percentages. So if you try to break it down into percentages, it's misleading. Does that help? So it's NBCOT's scaled score. They take your raw score and they convert it. Some of the exam items you're being scored on and some of them you're not. So here's something that's really important to know. Clinical reasoning, critical reasoning is used throughout the OT process. And that's primarily what NBCOT is testing. They're not testing specifically your knowledge of OT, although that's the basis for your reasoning. These questions are written to specifically target your reasoning. Do you have the clinical reasoning and the critical reasoning to be able to answer these questions? And so think about when you implement the intervention, you want to use good critical reasoning, good clinical reasoning, so that you have evidence. If I do this, I can expect a positive outcome. And if the frame of reference is mentioned, make sure that the intervention is consistent with that. It needs to be purposeful activity and occupation based. We certainly can use preparatory activities, but it has to be stated as such. So look for those things. A lot of the questions I find it's helpful to have good task and activity analysis because they'll say which is best to do here. And it really helps to know that. Excuse me. Activity adaptation and gradation, those are skilled services. So you want to make sure to know those as well. And like I said, it might include preparatory methods. It should be client-centered and collaborative. This is an occupation-based client-centered exam, which fits in with evidence-based practice for OT. We want to be providing occupation-based intervention. So it has to be purposeful activity or occupation-based that fits the client. So it's suited to them and meets their needs and their goals. And if we have education and training, so education, so educate, instruct, all of those, teach are skilled services. Training a little less so, usually that'll be okay, but think about education is more specific to what you're doing. And of course, therapeutic use of self. And we certainly use the group process, therapeutic groups, different activity groups, and there's group leadership guidelines that fit in here too. All right, let me check the chat. Is there any way to know what you should aim for percentage wise on therapy ed practice exams? So yes, I can tell you my perspective of that. If you look at the guidelines for online exams, you're going to see that it says you should be shooting for an 80%. But if you're getting from 68% to 72%, so shoot for 75. If you're getting between 68 and 72%, that's the sweet spot that you're looking for. Okay, of course, anything higher is better. But also what I'd like to point out to you, I don't care where the practice exams are from, any source, none of these practice exams are predictors of how you're going to do on the actual exam. They're just indicators of what you did at that time on that exam in that environment. Does that make sense that it changes? So anything that you want to ask about answering questions, strategies for answering questions, I can get to later. So if I don't scroll back here, remind me. Let's get on with this. So reevaluation, which is more commonly referred to as intervention review now, is when you reevaluate the plan and the client's progress. So it really might be another formal evaluation using the same assessments that you used for your evaluation, or it might be less formal. So it depends on how you have it set up. I really like to have pre-intervention and post-intervention measures so that I can more specifically document what the progress has been as a direct result of OT. So after you do the reevaluation, and that again is the primary domain or responsibility of the OTR, because it includes that interpretation of what's going on. And then the determination has to be, do you continue the intervention as it's written? Do you need to modify that plan? Or is it time to begin discharge planning? And at that time, you begin to identify any needs for referrals as part of that whole discharge process. So discharge is a process, not an event. And then for the outcomes, that's where we utilize those outcome measures that we identified when we did evaluation. And we're trying to identify, so what are the specific outcomes? And we want to compare progress to the goals that we wrote. Have they met the goals? Have they not met the goals? Obviously, we do that all along the way, but this is the final review. And you analyze the effectiveness of those interventions. That's so important for us to do so that we can continue to improve what we do and the evidence approach of doing that with specific outcomes that we can demonstrate both to people in our field, other members of the team, and to reimbursement third-party payers, the reimbursement process. Okay, so I'm going to show you the exam item of the week. Any questions on this? This is pretty foundational, isn't it? I think it helps to just refresh your memory of it now and then, though. Especially since often you get it in the beginning of your OT education and might not touch on it in the same way as you go through the courses. So every Thursday we post an original exam item. It's on the Facebook page, Twitter, and Instagram. So the questions posted on Thursday, the answer and rationale posted on Sunday, and then during office hours, we address it. So that's what I'm going to do now. Let me just check and see if I have a poll up here. Yes, I thought so. Good. So I'm going to show you the question. I'm going to put up the poll. If you've already seen it, that's fine. But if not, here's your chance to take a look at it. Come on. There we go. And when you're ready, please put your answer in the poll. Just move the poll out of your way. So thank you. Somebody put answer in the chat. If you can't see the poll, because sometimes if you're logging in from a phone, it just doesn't show. Sometimes it does, sometimes it doesn't. Did I throw you a curveball here? All right, we're up to 54% who participated in the poll, but because we have some people who are doing in the chat, it's going to be hard for me to know. So I'll give you just a little bit longer. So something that you might, when you look it over in a review book or whatever notes you're using, you might just say, oh, that's easy. I know the OT process, but look at this question is based on the OT process. And now you have to stop and think of it in a different way. So it's not always as straightforward as you would like it to be. I find the NBCOT is good at making their questions complex. All right, so let me share the poll with you. So look we have a scatter plot. We hit them all. The majority answered D, followed by C, then A, then B. Let me get that out of my way. So I'm going to read it in case that helps everybody. After an acute hospitalization, an adult with bipolar disorder is referred to a partial hospitalization program. Which should the OT practitioner do first? A, collaborate with the client to establish short-term and long-term goals. B, determine procedures to measure the outcomes of intervention. C, have the person complete an occupational interest inventory. D, identify supports for and hindrances to the person's occupational performance. And drum roll, please. The best answer is C, have the person complete an occupational interest inventory, because it says they've just been referred to a partial hospitalization program. So what do we do when the person gets a partial hospitalization program? We have to do a screening. Remember what comes first? Screening before evaluation. So the purpose of the screening is to determine if they need a full OT evaluation. So part of that is trying to determine their interests. Questions on that?
COPAM? Is it like COPAM?
No, so it's not anything specific. So an occupational interest inventory is, you could certainly get some of that through the COPAM, but there actually is, like, there are interest checklists. This is just using a generic term of what are their interests in terms of occupations. Okay, so let me, you're welcome. Let me check the chat. Why not D? Because if you identify supports for and hindrances to the person's occupational performance, you're already doing an occupational profile. Screening comes first.
Oh, D is occupational profile, right?
Yes, it is.
So in occupational profile, we can use the COPAM?
Yes.
Okay.
Yes, you can. Or you can use it as part of your overall evaluation, but the occupational profile is the first step of evaluation. So yes, you can use that for that. And I love the COPM for a pre-intervention and a post-intervention measure. I think it's a great outcomes measure. It has test, retest reliability.
Do they also using sometimes in the screening COPM or not?
It's possible, but it's usually more information than what you gather in a screening. It's possible. I mean, there is some variance in how people do it, but it's usually part of the evaluation. Okay, so we have another question. It's like, may I ask, discharge from acute to partial is a whole nother process? Yes, it is. So every time you go from one setting to another, it kind of, I'm going to use the term resets the OT process, because now it's a new person, a new occupational therapist who's seeing this individual. So it's a whole new admissions process, evaluation process. So it resets the process. Does that make sense? I haven't used that term before. Okay, so good point. That can throw you off. So that's why I wanted to point out that even though this sounds like really basic foundational information, sometimes when it's in a question, it's not so straightforward anymore. In the screening, are assessments typically given or only in the eval? That's what confused me. So it varies. It really does. So this is not saying that it's a specific assessment, occupational interest inventory. But it might be. You might use something like the interest checklist, but it says occupational interest inventory, so it's broader. And then it would be specific assessments for the evaluation. You might have a tool that you specifically design yourself with set questions and procedures for a screening, but it's usually not a formal assessment tool that's used. Okay, so any other questions about this part of the content? So then what I'm going to do is to stop recording and then I'll address any other questions you have. How's that sound? Thank you so much for joining me this evening. I'm not wrapping up yet. I'm just going to stop the recording.